Hi, it's Dr. Rich here from Salvatore Dental. We get a lot of questions about tooth extractions, so I wanted to go over the most common questions we get to give you a little more information on tooth extractions in our office. A dental extraction is a procedure where, unfortunately, there's a tooth that cannot be saved, or it could be a baby tooth that needs to be removed. An extraction literally is getting the patient numb and removing the tooth. Some patients come in wondering what are the reasons that a tooth extraction may be necessary. There's a few different categories of why. One, the tooth, unfortunately, could be broken from trauma, maybe fell or bit down on something the wrong way and broke the tooth. It could also, unfortunately, have an infection that can't be fixed by other means. It could be a wisdom tooth where there's not enough room for that tooth to grow in so that it has to be removed. Or it could be a baby tooth that just didn't want to leave on its own and needed a little bit of a nudge. A lot of patients don't know that there's actually a few different types of tooth extractions. We have simple extractions, which, that kind of is self-explanatory. It's an easy procedure. We get the patient numb and the tooth comes out very simply. Then it moves over to like a surgical extraction. A surgical extraction is a little bit more of a surgery where we have to do other means to take the tooth out other than just a little bit of pressure. Sometimes, unfortunately, we have to section the tooth or remove some bone around the tooth to get the tooth out. Then there's even more complicated extractions where we have teeth that are impacted. You might hear the word impacted once in a while. What that means is the tooth is stuck underneath. It can be impacted under bone and it can be impacted behind another tooth, and that requires even more further surgery. So there's a few different types of tooth extractions that could be necessary. A dentist would recommend a wisdom tooth extraction for a few reasons. One would be if there's not enough room in the patient's mouth for their wisdom teeth. So a lot of times patients go through orthodontics when they're a teenager, and then all of a sudden there's these wisdom teeth that are coming in and they can push on the other teeth, and now there's crowding and we've ruined all the work that we did to get the teeth nice and straight. For some reason, a lot of us are born without the room for wisdom teeth. So one reason why we take out wisdom teeth is just because there's not enough room for them. Other reasons we might lose wisdom teeth is if the wisdom tooth itself has some breakdown or decay or some kind of issue. And a lot of times those teeth do, because they're so far in the back, they're hard to get a toothbrush back there, difficult to get floss. So oftentimes when we do have wisdom teeth, they're harder to keep clean, and oftentimes they can have issues and may need to be removed. So patients ask, when would braces require tooth extraction? It comes down to if there's enough room in the mouth for all the teeth. Sometimes the teeth are big, the patient's mouth is small, and there's just not enough room for all of the teeth to be in the right positions. So if the teeth are all over the place and there's a lot of crowding, the orthodontist might make the decision that a few teeth may need to be removed to make room so that all the other teeth can be in the correct positioning. A common question that I hear is, can tooth extractions be advisable for young patients? They definitely can be. Sometimes a patient could have an issue with a baby tooth that is retained and doesn't want to come out, and now there's not enough room for the adult tooth to come out, or it can actually push the adult tooth in the wrong direction. So that baby tooth may need to be removed. There could also be a really big cavity that cannot be fixed, so we would advise for that tooth, unfortunately, to be removed. So patients ask, when would a tooth extraction be necessary with gum disease? That kind of matters on how severe the gum disease is. So gum disease can get to the point where it's not just the gum that goes away, but also the bone. So if the bone goes away around a tooth and the tooth is moving around, and sometimes, unfortunately, it's advised to take the tooth out. One really telltale fact is when we have a tooth and you can actually push on it and it goes up and down like depressible, then unfortunately that tooth is a little bit too far gone. Some patients ask, are all tooth extractions considered oral surgery? This is true. The actual tooth extraction is a form of oral surgery. So surgery is where you're physically removing something from the mouth. Oral is mouth. So tooth extractions are oral surgery. Patients often ask, what's the difference between a simple and a surgical extraction, or simple removal versus a surgical removal? It's literally just how easy that tooth is to come out. So if the tooth is really loose and nothing has to be done besides some pressure around to get the tooth removed, that's considered a simple extraction. If the tooth is a little bit more difficult to get out, it's broken, it's fractured, there's an area that we couldn't get out in one piece and we have to actually section the tooth, make the tooth into a couple pieces, or remove bone around the tooth, that's considered a surgical extraction. So simple extraction is simple, surgical extraction is a little bit more complicated. Patients, unfortunately, are looking around sometimes for where they should go if they need an emergency tooth extraction. I would recommend coming to Salvatore Dental for emergency tooth extraction. We do a lot of extractions here. We do see emergency patients. We've got an emergency line. We know that a tooth that's broken or an infection can really be a showstopper and really put your life on hold. So we do everything we can to make sure to get our patients in and to get that tooth removed if it needs to be removed. A common question that we get is, how long is a tooth extraction going to take? It's pretty variable, meaning if it's a simple extraction or a baby tooth, it could be after you're numb, it could be 30 seconds. If it's a more difficult, impacted tooth, one that's under the gum, under the bone, or a surgical extraction, it could be up to honestly an hour. So the way we book things here is dependent on how difficult that extraction seems to be by looking at the x-ray, by doing an intraoral exam, and then we can estimate it. Usually it's between a half an hour to 1 hour. A common question we get is, will I need a dental implant after tooth extraction? The answer to that question is depending on which tooth is removed. If you have a baby tooth, we take the baby tooth out, I don't think we're going to give you an implant. That'd be kind of weird. And then if you have wisdom teeth, there's really no reason to put in implants in wisdom teeth. What we do here is we really do want to have an implant for any essential tooth, meaning any chewing tooth in the front or any tooth in the back as well. A lot of patients just want, the teeth in front replaced. They kind of neglect the back ones, but the back ones are just as important for stability. So we recommend a dental implant to replace any front and back teeth. A question that we get a lot is, will I be asleep for my tooth extraction? We have the ability here to have an anesthesiologist come in where you can have an IV sedation. You can actually be asleep with the help from a board-certified anesthesiologist. Sometimes that can be a little bit overkill for an extraction. So we have other ways too. We can do a light conscious sedation where you take a little pill, and then you can have some laughing gas, and then you have less anxiety and you don't really have to worry about the procedure as much. And then we could even just do some laughing gas. You put the gas on, it works while you're here, you can take it off, and then you can actually drive yourself home. We have other patients who are okay with just being super numb, you don't feel any pain, and we can have the tooth removed that way. A lot of patients ask, how do I take care of my teeth or brush my teeth after a tooth has been extracted? The way you do it is to be very gentle and gingerly in that area. The day that the tooth comes out, I honestly wouldn't put the toothbrush anywhere in that area. I would stick me to the other sides, be very careful, and then also staying away from any vigorous rinsing. So you really want to be super delicate. And then as you start to heal a little bit more, come 3 or 4 or 5 days, then you can start gingerly keeping that area clean, but never be super aggressive while all the gum and the tissue is healing. Many patients have questions about the tooth extraction aftercare and what they should do. So what we recommend here at Salvatore Dental is to ice. I say ice, baby. Make sure we got ice on the area. That's going to decrease all the swelling. 15 minutes on, 15 minutes off for as long as we can really tolerate. Going home, laying down, keeping the blood pressure really low. I don't want you going out like running a marathon or doing a CrossFit program. We want to keep the blood pressure low. The reason being is if the blood pressure is super high, it can actually start bleeding again because the blood starts pumping a little bit too much. When you lay down and you go to sleep that night, I'd keep your head slightly elevated. You can use an extra pillow to help keep the swelling down, and then going on the appropriate pain control and then antibiotics if it's necessary. And really just being careful of that site. We don't want to swish. A lot of people want to go home and maybe think keeping it nice and clean is a good idea. It's actually better to not touch the area. The first step in healing is a blood clot. So we want that area to actually clot, for that to stay in place and for that to not leave. So rinsing or spitting could have that clot come out. So really be careful in that area, soft foods, taking it easy, and making sure that you follow all the post-op instructions. A common question I get is, should I avoid rinsing after tooth extraction? And the answer to that is definitely. Rinsing, although it sounds like a great thing to do afterwards to keep the area clean, is actually could cause an issue called a dry socket where the area doesn't heal and it's very painful. And the reason why we don't want to rinse is that the first step to healing is for a blood clot to form in the area. As gross as this sounds, take a tooth out. We want that area where that tooth used to be to have a blood clot that's formed. The first step in healing is a blood clot. Eventually that blood clot turns into soft tissue, and then eventually that soft tissue will turn into bone. And that's how we properly heal. If we rinse too early, that blood clot is lost, which is the first step in healing. And now that area is open. And the term dry socket literally means the socket where the tooth came out now is dry. There's nothing in it. It's dry, and it's not a great area for healing. So now, unfortunately, the pain's going to come on, and it's very difficult to stop pain from a dry socket. So the number one rule at Salvatore Dental is do not rinse after a tooth extraction. A common question we get is, how long should I wait to exercise after a tooth extraction? It kind of depends on the severity. If it's a simple extraction, then maybe only a day or two. But if it's a big surgical procedure with multiple teeth being removed, then I would definitely put some time, 3 to 4 days before you're having a big vigorous workout. You could definitely go out for a walk and something. The one thing we want to stay away from is anything that really elevates our blood pressure or any kind of like really thumping and thudding, because that could start to have the area not heal correctly. You can lose a blood clot, and then we could lead to other issues down the road. Many patients ask, how long does it take to recover from a tooth extraction? It depends on a few things. One is how difficult the tooth was coming out. If it was a simple extraction or surgical extraction, if we did one tooth, did all of the teeth, and then also, the age of the patient and the medical history or other kind of factors that are going on with their health. So surprisingly, a lot of patients can have a tooth removed. They feel great. They take a little bit of over-the-counter medication, and by the next day, they're feeling fine. Other patients could take more of a few more days and have to incorporate some antibiotics and some stronger pain control. A lot of patients ask, when should I schedule an appointment for tooth extraction? The answer is yesterday. Stupid as that sounds, a lot of times we wait, and then we don't want to have that tooth removed, and we're waiting till it actually hurts, and then we make the phone call. And sometimes it's a little bit too late. If the tooth is already hurting, already has an infection, it's more difficult for you to be numb in the chair. So the real answer to that question is you should have the tooth removed as soon as it's diagnosed that it needs to be removed. As soon as it's cracked, you run to the dentist and you figure out if that's what's needed. I hope I've been able to answer some of your questions about tooth extractions. And unfortunately, if you're in the position that you may need an extraction, please don't hesitate to call. Or if you have any other questions, feel free to reach out. It's 518-899-6068. We're here to help.